Hi, it's Gordon here from Transplant Links Community. I was talking to Nick Inston, one of our consultant surgeons, the other day, and he mentioned about possibly just doing a bit of an explanation on what the instruments are that we use on the picking tray. And then I thought, well, perhaps it would be a good idea just to do a video on how we set up the picking area, why we're doing what we're doing, the instruments that are involved, and just a general sort of summary of it. So if we do think about the picking area, it is just really a workstation where we can do a cold perfusion on the kidney. We can pick some of the vessels, do any repair work that we need to do or alterations, and it's just a question of cooling that kidney down, getting all the blood out, making sure all parts of the kidney are as viable as possible. Now, when we've retrieved the kidney, we really need to do a cold perfusion as quickly as possible. So you have to set up the picking area as close to the surgery as you can, which just allows a really nice, clear, quick passage from the operating table to the picking area. You use a silver trolley and you drape it, usually with 270 by 70 drapes, because it does get soiled quite heavily with the solution that we're using to cool the kidney down and flush it out. So that extra bit of water resistance is vital to keeping the whole thing sterile. We use picking instruments, which we'll go through later, supplementary items, a stainless steel bowl, which is a sterile bowl, and then we've also got access to suction, a drip stand with a pressure bag, and then we've got a bowl stand with a separate stainless steel bowl, and that's got unsterilizing it. Eventually what we'll do is we'll put a sterile drape over the top of it, and then our sterile bowl on top of that, and it just keeps it really nice and cool. So what is in the picking tray? So we have a BP handle, which we're obviously going to attach a large blade to. We need to take the outer packaging from the Ringer's solution, and it's just been found to be the easiest job. We need tissue holding forceps, and we've got DeBakey and McIndoes. We do need two forceps because occasionally you do have an assisting surgeon or technician just helping with the cold perfusion, and an extra pair of forceps is very useful. We need scissors. We need to cut along the suture line. So McIndoes and Potts are very useful for that. And just generally sort of tidying up the vessels. Watson chain probe is used to just keep the vessel open if they're doing any suture work. Mosquito forceps, great to clip along the staple line, and just it gives you an extra bit of traction on it. And just generally helps you keep things tidy, like the suction out of the way. We do need a needle holder. That's again if there's any sort of repair work or alterations to the vessels we need to do. The Tibbs cannula is very, very important because that's what we're going to use to do the cold perfusion. It's quite a nice wide bore Tibbs, and it can get quite a good flow rate through it. And the other thing is a toffee mallet. We need to bash the ice. You need some bigger chunks, some smaller chunks. And then I suppose we move on to the supplementary items. I'll try not to bore you by going through the whole of this list, but the 20mm syringe with pink Venflon, we just need the cannula bit out of that really, because what we do is we just fill the syringe with the cold Ringer solution. And if the vessels on the kidney are too small to allow us to put the Tibbs in to do the cold perfusion, we can use the pink Venflon. It is slightly narrower, and it just allows us to continue with the cold perfusion of the kidney. Now when we're doing the cold perfusion, the receiver that we're doing it in will start to fill up with blood-stained Soltran solution, and we do occasionally just need to suction it out. It does also allow us to just gauge how well we're doing with our cold perfusion. As it starts to run clearer and clearer, we can really sort of know when to stop, and it's usually